Hello, good evening. Welcome to yet another video from BEDSIDE-UK. This is founder of BEDSIDE Diaries, Dr. MJ Wesley. Today we are going to see about dermatology workbook. Many times I found medicine residents and even candidates preparing for exams like MRCP, UK, Ireland, DNB residents, people preparing for USMLE or even PLAB as well. Like when they are asked to describe a skin lesion or tell what it is, they end up calling it as a rash. There is a rash in the leg. That's not how you are supposed to describe or present the case to an examiner or to your attending or to your consultant or to your registrar. So there is a way to describe all the lesion. So this video is especially made to help you understand what are the basics of dermatology, how to describe a lesion. All right, here we go. 3, 2, and 1. These are the primary lesions. A lesion can be a macule that is less than 1 centimeter, it's flat. It can be a patch if it is more than 1 centimeter, again, it's a flat lesion. Then it can be a papule, again, less than 1 centimeter, it's slightly raised or depressed. Then there is a plaque that is more than 1 centimeter, again, it's slightly raised or depressed. If there is a raised more than 1 centimeter lesion filled with solid or fluid, then you call it a nodule. Then the same with fluid, but less than 1 centimeter raised is a vesicle. If it is more than 1 centimeter raised and filled with serum, blood, and lymph, then it's a bulla. Then there is a pustule. Pustule means PS, pus. It's filled with pus. It's raised and less than 1 centimeter. Okay, now we are going to see all this lesion individually and how to present. What you're seeing in the screen is a macule. What is a macule? It's a flat, even with the surface level of the surrounding of skin or with the mucous membrane. Okay, and perceptible only as an area of color change. Just the color change will be there. Can you see this? These are all macules, small macules. Macules are, like we read, it's less than 1 centimeter in size. Then comes a patch. What is a patch? Patch is like a macule. It's a flat area of skin or mucous membrane with a different color from its surrounding. Patches are typically 1 centimeter or larger in size. What you are seeing here, this is a patch. This is a patch. All right. Then comes the papule. Papule is an elevated or a depressed lesion. Typically, that is less than 1 centimeter in size, which may be solid or cystic. Among the characteristics, papules may be further described based on their topography. All right, it can be a sessile papule, it can be a pedunculated papule, can be dome-shaped, flat-topped, filiform, mammillated, acuminate, or conical, or an umbilicated papules, like that of your molluscum contagiosum. All right, this is how you describe a papule. Then comes your nodule. What is a nodule? Nodule is a palpable lesion that is greater than 1 centimeter with a domed spherical or ovoid shape. It can be solid, it can be cystic. Based on the anatomic location component, it can be primary nodule. The primary nodule can be of various types: epidermal, epidermal and dermal, dermal nodule, dermal, subdermal, and subcutaneous nodules, like that of nodules are there. Then comes a plaque. How do you describe a plaque? It's a plaque is a solid plate, plateau-like elevation or depression that has a diameter of 1 centimeter or longer. Then comes a vesicle. These are all the vesicles. For example, herpes. You will find vesicles. It's a fluid-filled papule, smaller than 1 centimeter, where a bulla is the same one with 1 centimeter or larger. This is a vesicle, and this is a bulla. Then comes a pustule. Pustule is a well-circumscribed, raised papule in the dermis, epidermis, or infundibulum containing visible pus. This is a pustule. All right. So some other miscellaneous terms you need to know are a crust. How do you describe a crust? Crust is a dried fluid on the skin surface due to serum, blood, pus, or a combination of. Then there is something called lichenification. We see lichen planus. There is a separate video on lichen planus in Pace's diaries. It's a thickening and accentuation of the skin lines that results from repeated rubbing or scratching of the skin. It's found in chronic eczematous process or neurogenic process. Then atrophy. Epidermis, atrophy of the epidermis is a result in the shiny quality with a cigarette paper wrinkling. Atrophy of the dermis results in a depressed lesion. Then comes the fissure. People know about anal fissure. It's a linear loss of continuity of the skin surface or a mucosa that results from excessive tension. That's called as a fissure, right? So these are the different distributions of various lesions. Okay, you can just take a look at it. You can take a picture of it if you want. What are the lesions in the flexural area? Typically, you will get acanthosis nigricans, atopic dermatitis, and bullous pemphigoid. The lesion you will find in extensor distributions are your psoriasis, atopic dermatitis, dermatitis herpetiformis, and xanthoma. In the feet, you will find eczema. Okay, in the wrist or ankles, you will find lichen planus, scabies, contact dermatitis. And these are the one you will find in photo distributed areas, typically your lupus or a drug eruption. And mouth, you can find leukoplakia, four-day spots, pyogenic granuloma, candidiasis, like your squamous cell carcinoma. Axilla, again, you can find acanthosis nigricans, hidradenitis suppurativa, impetigo. Buttocks, you can find folliculitis, psoriasis, again hidradenitis suppurativa, and again scalp, you can find scalp psoriasis, seborrheic dermatitis, contact dermatitis, discoid lupus stuff. This is a picture I've drawn, and I know it's like kind of odd, but these are different lesions and the distributions, whatever we have seen just now. So these are some of the signs in dermatology you should be knowing. There is an apple jelly sign. There is an yellowish hue produced from pressure on the lesion with a glass slide. Any granulomatous process will show. Then there is Aspo-Hansen sign. That is a lateral extension of the blister. If you give a downward pressure on the blister, there will be lateral extension. Then there is Auspitz sign. This is very important. Pinpoint bleeding on top of ruptured capillaries. Okay. If you just remove the layer, that will be seen in psoriasis. Then buttonhole sign, typically you will find in neurofibroma. That's a flesh-colored soft papule, feels as though it can be pushed through the buttonhole. Neurofibromatosis patients, you will find that. Then there is a carpet tag sign where horny plugs on the undersurface of the scale removed from the lesion. This is in chronic cutaneous lupus you can find. Then Darier's sign. This is noted in urticaria pigmentosa, okay, and cutaneous lymphoma or histiocytosis. What will happen here? The urticarial wheal is produced in a lesion after it's firmly rubbed with a finger or rounded end of a pen. This is a Darier's sign. Then dermatographism. This is seen in typically in urticaria. Firmly stroking the unaffected skin produces a wheal along the shape of the stroke within seconds to minutes. All right. Then another important sign here you need to know is a Fitzpatrick dimple sign. This is characteristic finding in dermatofibroma. Dimpling of the skin with lateral compression. If you compress the area laterally, there will be dimpling of the skin. Okay. With thumb and the index finger typically produces a dimpling of the skin if you compress it laterally. This is your Fitzpatrick dimple sign. And Nikolsky sign, this is again classically seen in pemphigus vulgaris and as well as toxic epidermal necrolysis or your good old 10. Here, the lateral pressure on unblistered skin will result in shearing of the epidermis. All right. This is the apple jelly sign. What is it? An yellowish hue produced on the lesion when a pressure is given with a glass slide. This is typically seen in cutaneous sarcoidosis. Then this is an Albright dimple sign. This is seen in Albright's hereditary osteodystrophy, seen in young women with short stature. Fourth and the fifth fingers are shorter. And pseudo hypoparathyroidism, okay, due to disturbance in calcium homeostasis. Again. This is Asbo-Hansen sign, extension of the blister adjacent to the unblistered skin when the pressure is put on top of the vulva. This is an Asbo-Hansen sign. This is your good old Auspitz sign we have just seen. Okay, Auspitz sign. This is breakfast, lunch, and dinner sign. Typically, you will find in a case of a bed bug infestation. Okay, bed bug infestation. It follows a linear pathway in a group of 3 or 5 blood meals. So that's why we call it as a no. It follows a linear path. We call it as a breakfast, lunch, and dinner sign. Okay. Then this is the buttonhole sign we have seen in neurofibromatosis. This is a dimple sign again. This is the structural anatomy of the skin, if you like to know. So today we have seen the very basics of different types of skin lesions and how to present those lesions. So we will again see you with yet another video for the series of bite-sized medicine from Faces Diaries. Thank you so much. If you like this video, please give a thumbs up, share, and subscribe. Thank you so much. Have a great day.